So you may be wondering whether you should have a doula at your birth or a midwife, but we're here to tell you that it's not an either or. There are two different types of support. And so in this video, we're going to break down what is a doula, why might you want one, and then what is a midwife and how do they differ from one another. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the founder of MamasteFit. And I'm going to share with you what is a birth doula and how can a birth doula support your birth.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife. And I'm going to be describing what is a midwife, what are the types of midwife, and how do they differ from a doula.
So first, the main difference between a midwife and a doula is the type of support that they provide for you for your birth. A midwife is a medical support provider, so they are providing you your medical care during your pregnancy and during your birth, while a doula is a non-medical support person for you that provides continuous labor support. They can also support you during your pregnancy with non-medical care, and then during your birth, they tend to stand by your side and help you with like labor positions and kind of help coach you throughout your birth. And so there are two different support persons for your birth. One is a medical support provider, and the other is a non-medical support buddy for your birth. But let's break down what is a midwife and what is a doula. So Roxanne, can you share what a midwife is?
So again, a midwife is a medical provider who is attending your birth, catching your baby potentially, as well as providing prenatal care throughout your pregnancy and even your postpartum, continuing to check on you and baby. So during pregnancy, they're doing your vital signs, looking at your labs, doing ultrasounds potentially, and like assessing baby's growth to ensure that baby is growing and you're having a healthy, normal pregnancy, for lack of a better word. Then during labor, they're there to support you as well as identify potentially any sign like red flags or pink flags during labor that might necessitate more interventions, and then help to assist the delivery of baby as well as the placenta. And then in the postpartum, just kind of helping to support both you and baby entering into motherhood and parenthood. They are a medical provider though, so they can do primary care even. So you can see a midwife for preconception and even after you're out of the childbearing years for like your annual pap smears, as well as like pre and post menopause care as well. So like they are a advanced practicing nurse, so they can do other things outside of pregnancy that you can see them. A lot of people think that you can only see a midwife during pregnancy and postpartum, but you can see them before as well as like way after childbearing years, because the type of midwifery care that people receive is different than like the traditional medical model. Midwives' philosophy of birth is that they do support more like normal physiologic births. So they're taking care of more lower risk pregnancies than like an OB provider. The OB providers are like the subject matter experts of like high risk pregnancies, as well as they are seeing a lot of low risk pregnancies. But like the thing that they're more important for are those higher risk pregnancies as well as C-sections, because a midwife cannot perform a C-section by themselves, as well as some higher risk pregnancies. They are not qualified or like experienced in those higher risk pregnancies. So most midwives are really good at knowing what the normal pregnancy is. And when something is not the normal, they are like, yep, this is the time that I need to bring in those OB providers. Midwives work, though, very closely with doulas, but they are not the same thing.
So the question is not necessarily should you have a doula or a midwife, it's more should you have a midwife or an OB to support your birth in regards to the medical support that you want for your birth.
But if you are choosing a midwife, there are many different types of midwives. So there are certified nurse midwives, and these are registered nurses who attend a graduate level like midwifery degree course, and then they do their clinicals and then take a board certifying exam to become a licensed medical provider or a licensed advanced practicing nurse, depending on the state. The other type is a certified professional midwife, or CPM, and these could also be called lay midwives or even licensed midwives. These are not licensed in all 50 states. I think it's like 26 or 28 states that are licensed in and regulated. But these are ones who take some courses on like anatomy as well as pregnancy care, and then also learn most of their skills through apprenticeship. So they shadow another midwife to learn all of the skills of like pregnancy and labor as well as postpartum newborn care. Most CPMs are going to work in a community birth center, whether it's a freestanding birth center or a home birth center, depending on the state. If they are a licensed state, you can find them in those birth centers. If it is not a licensed state, most likely they're going to only be in home birth settings. So it's really important to know your state legislator of which ones are licensed within your state, and so you know which midwives you're going to be able to find, whether in hospitals or how easily it's going to be able to find a certified professional midwife to attend your labor if that's what you're wanting. So a midwife is someone who's going to take care of your pregnancy, birth, and postpartum for the medical aspect. So they're going to be ensuring your pregnancy is progressing normally, as well as attending your birth and labor to ensure that your labor is progressing normally, to look for any signs that maybe there is a reason that we need a higher level of care, or just be there to catch your baby, as well as deliver your placenta, do all the repair and say, yay, your baby's here. And then in the postpartum, to also ensure that the postpartum is progressing normally as well.
So in comparison, a doula is a non-medical support person that supports you at your birth. Doulas are going to provide physical support, emotional support. They're going to help with advocacy and also provide education or information so that you can make decisions that work best for you. Doulas are going to provide continuous labor support, so they're going to be by your side pretty much for when you're active until your baby is born, most commonly. Some doulas will come a little bit earlier, depending on like the circumstances of your birth and kind of what you guys have already established prenatally. Doulas can also provide support throughout your pregnancy. So for me as a doula, I typically have like a few prenatal meetups with my clients throughout their pregnancies. And the good thing about this is you can really develop a relationship with your doula. And so this is going to allow them to provide a lot more emotional support at your birth. Commonly with like your medical providers, you're only seeing them periodically for your prenatal appointments throughout your pregnancy. And this does get closer together as you get closer to your birth. But with most hospital-based clinics, you're probably not going to have one specific provider at your birth. It could be like a team of different midwives or a team of OBs, and whoever is on call is at your birth. And so you can have this one person that you know is going to be there with your doula to help support you during your birth with continuous labor support. The reason that a doula can provide continuous labor support while potentially your medical provider, such as a midwife, could not, is because the doula is there for just you. We don't have other clients that we're running from room to room with, or we shouldn't. But a midwife is going to have multiple patients they're probably managing at the same time. They may have like a whole floor that they're managing at the same time. And so usually they're going to be in your room, check on you, and then they got to go check on somebody else because they're kind of monitoring multiple labors at the same time. So during your labor, a doula can help you with labor positions. They can help you with comfort measures. They can guide your partner to do different things to help support you during your birth. They can provide that emotional support as well to make sure that you're feeling good during your labor. Doulas can also help you advocate for yourself by facilitating communication with your provider or with your medical team. Because sometimes you don't know what questions to ask, or you don't know like what things you can even ask questions about. Because when you're in a medical setting, you don't want to do anything that's going to harm you or your baby. And so you might not know, hey, I could actually ask for these IV fluids to be turned off, or in what circumstances that maybe you do want those fluids to kind of maintain. And so they can help you know what kind of questions to ask so that you can make a decision that works best for you. However, a doula should not be making those decisions for you. They should just be helping you gather the information that you need to make a decision for yourself. But as Roxanne was saying, a doula and a midwife tend to work really well together to help support your birth as a unified team. So it's not like an either or us versus them. Your medical team and your non-medical team should be working together to help support you to have a better birth.
With a doula, there are different types of doulas as well. So if you start to look for one, look for a birth doula, because there are postpartum doulas. There's so many different types of doulas that they are like just continuous support is the kind of definition of a doula. But a birth doula is someone who is going to support you continuously throughout labor. And then there's a postpartum doula, which could be really helpful for people in the postpartum who will continuously support you throughout that postpartum period. So finding one of those could also be helpful to know which one you're actually hiring.
It's also really important that you're able to develop a relationship with your doula throughout your pregnancy, because that's kind of the key thing that makes doula support really different, is that ability to have that relationship. And then making sure that your personalities like mesh together well and that you vibe with the doula, because like personality is huge. Like I'm not the best doula for everybody, and other doulas are not the best doula for anybody either. So it's more about finding somebody whose experience level and their personality is a good fit for you. Another reason why it might be helpful to have both a midwife and a doula to help support your birth is each is going to bring a different set of skills to support you during your labor. So for me as a doula, because I provide continuous labor support, I'm going to be able to notice these subtle cues and changes that are happening during your labor. And because my tool set is going to be non-medical, so I'm going to be focusing most on laboring positions and more like holistic methods to help support your birth, that is going to be my primary tool set to help support issues that may occur occur during your labor. So if you're having a labor stall, my first thing that I'm going to try to do is to figure out what the labor stall is. Is it related to how you're feeling during your birth? If so, we're going to do a fear release together and kind of figure out, can we release some tension like emotionally to help your labor progress? If it's related to space within your pelvis or your baby's position, we're going to be focusing on like movements and release techniques to help you physically be able to create more space within your pelvis. But that's because my tool set is non-medical. So I'm not going to be using medical tools to help resolve things during your labor, which may be something that you want to explore before maybe a medical option.
Whereas your midwife is able to utilize those medical interventions as well as do internal and hands-on assessments to see what's going on with your labor. So Gina, it's really helpful to know all of these different positions, but something that she really needs to know to be able to know what positions to put you in to optimize the labor is what position is baby in. And that's not something that she can assess personally. That is something that your midwife or your provider is able to do with either hands-on assessments or internal assessments to be able to identify what position is baby in, as well as if maybe none of those things that she utilizes works, we have those medical interventions of breaking the bag of water or using Pitocin or using different medications to potentially help, as well as we have different skill sets as midwives to be able to help labor progress as well.
So hopefully this video was helpful for you to understand what is the difference between a midwife and doula and why it's not either or, but rather maybe an and. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release new workout videos every week in addition to new educational videos like this every week as well. If you're pregnant and you would love more support during your pregnancy, join our online prenatal fitness programs and online childbirth education course so you can move confidently during your pregnancy as you navigate your birth and understand what is going on with all of your options. You can also bundle our prenatal fitness and childbirth education course together to save an additional 15% off.
If you're in the postpartum and you're looking for some more education, we have an education course of what to expect in that postpartum period, as well as what to expect with baby. That also comes with infant massage and infant and toddler CPR. We also have postpartum fitness programs to help support your return back to fitness after having a baby.
And if you're a professional and you want to learn more from us while earning CEUs, you can join our birth worker course and our pre- and postnatal fitness trainer course.
And you can use code YouTube10 to get 10% off any of the courses that we offer on our website at MamasteFit.com.